Hello, this is Erik Pedersen. We're going to go through case number 9160. This is a case of a subdural hematoma. So we'll go through and talk about this case, um, show some of the findings, um, and hopefully have a little fun. So um, this is a non-contrast head CT. We have our standard configuration with axial reconstructions, both in kind of soft tissue algorithm and in bone algorithm. And then we have both coronal and sagittal reconstructions. So in this case, the primary finding is a hyperdense crescentic extraaxial collection that extends along the entire cerebral convexity on the right side. And you can see that that's overlying portions of the frontal, parietal, and temporal lobes. You can also see that there is subdural hemorrhage tracking along the parafalcine region on the right. You can see this thickening here on the axials and here on the coronals. There is also acute subdural hemorrhage tracking along the right leaflet of the tentorium, which is nicely demonstrated on the coronal image here. This is what the tentorium should normally look like over here on the left side. So there's a holohemispheric hyperdense subdural hematoma on the right side. It's got a maximal thickness of about 5 millimeters. You'll also notice that there's a thin hyperdense subdural hematoma overlying portions of the left frontal lobe, which are easily seen on the axial images and on the sagittal reconstructions. Secondary findings, we do have some mass effect here. You can see that in this patient with some underlying volume loss, right, based on the size of the sulci here in the left cerebral hemisphere, you can actually see that there's some sulcal effacement within the right cerebral hemisphere relatively. These sulci are tighter on the right than they are on the left, related to the mass effect. There's a little bit of compression of the frontal horn of the right lateral ventricle, as well as the occipital horn of the right lateral ventricle and right ventricular atrium. There's a small amount of right to left midline shift, which if we measure at the level of the foramina of Monroe from anterior to posterior, we're getting a very small amount of midline shift, between 2 and 3 millimeters in this particular patient. Other findings, the basal cisterns are widely patent. Both the suprasellar cistern and the quadrigeminal plate cistern are normal. You can see that this patient has some underlying chronic white matter small vessel disease, these areas of low attenuation, kind of patchy throughout the cerebral white matter, very typical for chronic white matter small vessel disease. There's some underlying volume loss, as we talked about. The posterior fossa looks good. The skull is intact. The extracranial structures look fine. The paranasal sinuses and mastoid air cells are clear. The portions of the orbits that we see are unremarkable. So the impression is holohemispheric left-sided subdural hematoma with mild associated intracranial mass effect and small left frontal subdural hematoma without significant mass effect, underlying white matter small vessel disease, and global cerebral volume loss.